Bismillah ar-Rahman ar-Rahim. Wassalatu wassalamu ala Muhammadin wa ala alihi wa sahbihi ajma'in. May Allah bless this Ramadan for us. May Allah bless us in the month of Ramadan and give us the forgiveness and healthy lifestyle in Ramadan and thereafter, inshallah. These are a few tips for nutritious Ramadan, inshallah, for the diabetics, and also it works for the non-diabetics as well. The first, I'll go directly to the topic. The first tip, and maybe one of the most important one for everybody, is to stay well hydrated in this month. So drink plenty of water from the time between iftar until suhoor. Of course, while awake, try to keep hydrated and drink plenty of water. For at the time of iftar, make sure that there are things do and things don't. So do again drink water, as actually applying the sunnah of the Prophet ﷺ, which he recommended that we break our fast on either date or water. And there's very good options. With the date, you may just for the diabetic limit maybe two pieces of dates. Drink lots of water. Try to get the meals. Do eat some fruits, some vegetables, some oats, which is the slowly energy-giving food. Do get some yogurt is a healthy option. Try the fresh, nutritious food in this month, and do not overeat. Do not overeat. Just eat in moderation. Eating plenty of food, even the healthy food, is not good for anybody, also for the diabetic specifically. Do not take when you eat too much carbohydrate. Carbohydrate, for example, bread, pizza, sweets, cakes, anything that high sugary food, try to avoid it or just limit it to the minimum. Do not eat lots of fatty food, and do not eat fried food, and try to cook with the smaller amount of oil. Don't cook with a lot of amount of oil. Specifically for the diabetics, do consult your doctor, your MD, either type 1 or type 2. Type 1, specifically for type 1, and make sure if you're able to fast. It depends on the frequency of the insulin that you take and the frequency of the meals and the snack that's needed. Type 2, most of type 2 diabetics should be able to fast, inshallah, and consult with the also doctor to adjust for the meals and for the timing of medications. So you should be able to fast with this consult. Follow the rules, as we said, the nutrition, as we mentioned, for iftar. One important thing for the diabetic, if they plan to fast, is to be careful of the low sugar. Of the cases you may get into low sugar because of the long hours of not eating. The signs of low sugar, or what's called hypoglycemia, is a person may feel shaky, may feel sweaty, may feel excessive hunger, may feel excessive fatigue. In this case, make sure you check your blood sugar, and if it's really low, so break your fast, eat something. Try to check your blood sugar few times a day. The best timing to check the blood sugar is maybe around 9-10 a.m. in the morning, and 4 p.m., around 4 p.m. in the evening. Also try to check it 2 to 3 hours after iftar. And this way you can see how high and how low your sugar, to try to adjust your meals, the amount that you're eating, and maybe the medications. For suhoor, it's very important now. We go to the suhoor. Something that's important, do not skip suhoor. As it's sunnah to eat, and suhoor is a blessing. Waking up before and eating and getting the suhoor is a blessing. And applying sunnah of the Prophet ﷺ, it's also very healthy and very important for the diabetic patients. So do not skip suhoor, and eat the same what we mentioned almost for the iftar. you can eat for suhoor the food that's whole wheat, seeded bread, oats, and of course, as we mentioned, plenty of water. Stay well hydrated, drink plenty of water, fruits, vegetables, milk. That will be very helpful. And we mentioned the oats, the whole wheat, the seeded bread, because it gives you slow energy and longer lasting energy, longer lasting sugar that will help sustain you for longer time, help you actually with your fasting. May Allah protect us all. May Allah give us the best blessing, forgiveness, and health in this month of Ramadan. Barakallahu fikum and Ramadan Kareem.